Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Well, good morning. Thanks for joining us on this Monday morning and starting your week off with us. I'm Ryan Kalei Suji, joined by Yunji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. This morning, Yunji, we return our conversation back to COVID-19 and check in with a guest that we always like checking in with from time to time.
Yeah, that is because he is the cream of the crop when it comes to infectious disease experts. Of course, we're talking about Dr. Tim Brown, Senior Fellow at the East-West Center, who is a frequent guest on this program. Thank you so much for being here this morning.
Oh, my pleasure, Eugene Ryan. Good to see you again.
I want to start with these positivity rates because they are so very high, but no one seems to be paying attention to them. Right now, I happened to check it before we got on this morning. Statewide, 18.9%. Honolulu, over 21%. And yet we're still going about business as usual. People don't seem so concerned. So how do we interpret these numbers?
Well, I think the problem is that the epidemic is being downplayed now, I think, from a political perspective, but also I think from a public health perspective. The reality is we're still in a very high surge. And that's what that positivity number shows, that almost 20%. And it's only coming down very, very gradually right now. We are going to be in this surge probably through mid-July. And that's assuming that we don't see another surge take off due to some of the incoming variants. And we can talk more about that later. But no, it isn't indicative that there is a lot of infection in our community. We don't have systematic surveillance set up that will allow us to get a clearer picture of exactly what's happening. But with that said, the number of daily cases has been hovering between 3,000 and 5,000 for the last 2.5 months. So that's comparatively stable, little bits of rise and fall from time to time. But that means that positivity rate is not a bad indication of what's going on in our community, which is that we're in a very serious surge. That's basically almost as high as the peak that we saw back in the original Omicron wave in January, February. So we are still in a very epidemic situation, and yet we're downplaying it. We're acting like nothing's going on, but the reality is people should be masking. The CDC guidance even calls for masking at this point. We are red on all of the CDC indicators at this point across the state right now. I think Hawaii had dropped off at one point. Now they're back up. So, we have a serious epidemic situation, but people are acting like nothing's going on. That's a real issue.
When we look at and we hear from state officials, the indicator that many are pointing to is hospitalizations. And while we are seeing an uptick in those hospitals, but, when looking especially at those with smaller capacities like the hospital in Hilo, they are also experiencing a quite full hospital right now. But political leaders and officials are saying that it is stable at this point in time, and that is why there is no real need to panic. What are your views on the state using that as the metric moving forward, realizing that not a lot of people are necessarily having the severe symptoms of the virus?
Well, I think number one, some of that will be due to the fact that there are better treatments available now. That's keeping some people out of the hospital. The reality is our hospitalizations, however, are still climbing. If you actually look at the HHS numbers, which are still reported daily, those numbers are still climbing fairly steadily over the last 2 to 3 weeks. So we're not out of the woods in terms of hospitalizations yet. And I think that, that's a real concern. Hospitalizations are also very much a lagging indicator. They're telling us what the epidemic was doing 3-4 weeks ago. And what we need to know is what's the epidemic doing now. And what it's doing now is it's producing a lot of illness in the community. We are seeing a lot of businesses that are having problems staffing right now because so many people are out sick with COVID. That includes our healthcare providers. They are being hit very hard by COVID, affecting their workforces. So we shouldn't be acting like nothing is going on. We are seeing major impacts economically in our healthcare infrastructure. and in the community, basically due to this ongoing spread that we are doing nothing to arrest. And that's the real problem.
Where's the peak then? If we are seeing, we are seeing a decline in the numbers when we look at those positivity rates. Of course, it leaves out a huge number of tests. Those, of course, are the home tests that are not counted in there. So we've had Libby Char in this program, and she says it could be 5 to 10 times the case count that we actually see reported by the Department of Health. So given all of that, are we on the downslope of this particular surge, or is there still more to come?
My estimate is that we're probably just past the peak. We're probably a week or so out from the peak. The question is whether it continues or not. And that's a very open question right now. There are new variants coming, BA4, BA5, which are now in the islands, which are now causing the case rates to start rising again throughout Europe. Many of the European countries basically are now seeing rising case rates. So I do think that, although we're on the downslope of this current BA 2.12.1 and BA2 wave, we may start to see increasing rates before too long due to BA4 and BA5, which we know are in the islands. They've been found on both Oahu and on the Big Island. And so we've got to watch for that. There's no guarantee we'll continue. And even if we are on the downslope, it's a slow downslope. We're still going to have high rates of community spread probably through mid-July at the rate that we're declining right now. So there is a lot of COVID in the community. It's making a lot of people sick. A lot of people are calling in sick to work or not being able to come into work because they're sick. And it is affecting our population in a fairly large way right now. So acting like it's not there and doing nothing to stop the spread is really a major mistake.
Hawaii as a whole has gotten pretty high marks in our response to COVID-19 when you look at the overall death rate within the state, as well as how the state has prepared to vaccinate its population, and is also, many are saying, is a direct result that we're just seeing mild cases because of our high vaccination levels. What are your thoughts as a whole as how we've done as a state and where we're at now with the number of population that has been vaccinated that has led to more of these mild-like symptoms that people are experiencing?
I think we did quite well as a state in terms of prevention because you're keeping the masking mandate in place. And the result of that has, through March of this year, basically was that is one of the first and major means of prevention that we have available to us. So it's really critical that that was in place. But with that gone now, we are seeing rather rampant spread of the epidemic throughout the population, and that's the real concern we've got. I think we did fairly well in terms of medical care, but part of that was because we did step up the prevention precautions whenever our hospital system got toward the edge. And let's remember, we hit the edge twice throughout that period of time. Without those prevention measures, we would have exceeded that. And the only thing that is protecting us right now is the fact that because our vaccination rate is comparatively high, that has kept the number of hospitalizations and deaths much, much lower than it would have been otherwise. But keep in mind, vaccines protection is waning. Protection due to previous infection is also waning. Therefore, the population is getting more susceptible to more hospitalizations and more severe illness as we go forward because of that waning of protections. There are also new variants which are coming, BA4 and BA5, which are on the horizon right now. They're actually here in the state at low levels, as far as we can tell. But those may be causing more hospitalizations in some of the places where they are manifesting. In Portugal and actually in Ireland right now, they are seeing a very sharp rise in hospitalizations that is associated with the spread of BA4 and BA5. So we've got to worry about that. New variants may actually cause more severe illness and potentially more deaths that may offset some of the benefits that are coming from vaccination. So it's a complex landscape.
Let's talk a little bit about treatments, because that is one tool in the toolbox that we have had not too long. And let's talk about the impacts that are making. So we have Paxlovid, which we know needs to be delivered within the first 5 days. There's also monoclonal antibodies. So can you talk about those two treatments? Are there any other treatments that perhaps I'm missing? And how available are those here in the islands?
Well, there's Paxlovid, which is the preferred treatment at this point. It's a 5-day course of pills. So you basically just take it orally, which makes it comparatively easy to administer. In high-risk individuals, it has prevented 80–90% of hospitalization, so it's been extremely successful in that regard. There is another treatment, remdesivir, which is now actually recommended for people outside the hospital. But the problem with remdesivir, and it has about the same, about 80% reduction in hospitalizations. But the problem is it has to be given by infusion over 3 days. And that means medically it's much, much more complicated to give it. And I think a lot of our hospitals here are very reluctant to do that because of the additional resource requirements that it places on them. So there's that. There is also Evusheld, which is a prophylactic monoclonal antibody that's intended for people who are immunocompromised. But in the United States as a whole, I'm not sure of the exact situation in Hawaii. It has been well characterized. But in the US as a whole, we're not using those supplies the way we should be. We've only used about 20% of the supply we have, and a lot of immunocompromised people have not received Evusheld. And it's a long-acting monoclonal antibody that for 4 to 5 months will actually protect you against infection. So it's definitely something to be recommended. We've lost other monoclonal antibodies. Regeneron, which is one we were using fairly early on, is gone. So Trovimab basically fell to BA2. Because what's happening is the virus is now evolving around our treatments. And so we've lost several monoclonal antibodies. We still have one that's effective at this point. And that is a big issue. And that means that our research on new treatments and so on has to continue to evolve as the virus evolves, because it is finding ways to work around the protections that we put in place.
You know, one of the common statements that we're hearing from many in the community who have gotten COVID-19 is that they have built up natural immunity, that through this process of getting it, whether it be from Delta or Omicron or whatever strain of the virus there was, that the fact that they have had that has just boosted their natural immunity, and they are maybe less worried about some of the dangers that COVID-19 presents, maybe not wearing masks as often because they feel like they have kind of sailed through this portion. Your thoughts on those who have this mentality going in with natural immunity, and how factual is that of them being protected by being boosted and this natural immunity through suffering through COVID?
Well, I think there are a number of factors that come into play there. Number one, the protection due to a past infection with Omicron is turning out, especially if you only had a mild infection, is turning out to be comparatively weak. It's actually not giving much protection against future infection. And in fact, BA4 and BA5 pretty much eat BA1 for lunch. Basically, if you had a BA1 infection back in December, January, it's probably not going to protect you very much against BA4 and BA5, which are starting to spread in the islands right now. So there's that. You know, the new variants are evolving around the past immunity that's in the population, not only to vaccines, but also to previous infections. Okay, so that's one factor. The second factor is that if you get the vaccine and then get infected, or if you got infected and then have the vaccine, you actually get broadened immunity. Your immunity against future variants is widened. It's something we call affinity maturation. Your body basically takes in the combination of what it learned from the vaccines with what it learned from the infection, and it uses that to broaden your response so it will be more effective against all future variants. Okay, so in fact, though, you know, in the past we used to talk about hyperimmunity or superimmunity for people who were vaccinated and then infected, and so it does broaden that. But people who just got the natural infection should not assume that that's going to protect them against future variants. In fact, the current variants are cutting through previous protections from Delta, from Alpha, from the other variants beforehand. So you got to remember, this virus is a moving target. It is evolving to work its way around all the protections that we put into place, and we've got to be playing catch up with it all the time.
You know, one of the things, we had Dr. Scott Miskovich on this program a while back, and one of the things that he flagged was long COVID, something that he says he's very concerned about. And while right now people, I mean, we all probably know plenty of people who have gotten the virus and who have come out the other side seemingly just fine. What are we seeing in terms of long COVID? You know, what is the percentage of people who actually develop long COVID, and what are your concerns about that?
Okay, long COVID is a syndrome. It's a set of symptoms that persist for some extended period of time after your initial infection. Most people tend to think of an infection as being, oh, I get sick, I'm sick for a couple of weeks, and my immune system kicks in, and then I recover quickly. And that's the way it works with most infections. With long COVID, what a lot of people are seeing is they're seeing their symptoms are extended over a longer period of time. They may go on for 4 weeks, they may go on for 4 months, they may go on for many years. Okay. And what we've seen, there are a variety of studies that have been done, and it really depends on what the study is looking for. Okay, the types of symptoms that are most concerning are extreme fatigue, to the point where people can't even get out of bed sometimes, or just getting or walking a flight of stairs is just an incredible nightmare for them. Difficulty in breathing, shortness of breath, irregular heartbeats, brain fog, difficulty concentrating, and this definitely can affect your ability to work. Memory problems associated with that, prolonged loss of smell and taste. So there are a whole variety of different symptoms. And not everybody has all of those symptoms. They get different combinations of those symptoms. But in the studies that have looked, if you're typically looking about 12 weeks out, about in the ONS survey in the UK, which is a cross-sectional survey, so it's a reasonable population sample, they're finding about 15% of people are still showing symptoms at 12 weeks out. Okay, some type of symptoms, it's some combination. In the shorter term studies, which look maybe 4 weeks or, typically somewhere between 20 and 40% of people who get COVID end up with at least one long-term symptom that may last several months.
20 and 40%?
20 to 40%. In fact, it's quite interesting. UHERO just came out with a survey that they did here in Hawaii, and they were saying 30% of the people that they interviewed, 31 point something, were reporting some symptoms of long COVID, and half of those, that was of those who were infected, and half of those were reporting that it was serious symptoms, that it was something that was affecting their life and their ability to work. And when you work that out on a population basis, that works out to about 4% of the people having moderate or severe symptoms long after their infection. So it is a serious problem in the population, and it is something that will come to haunt us in the future because it's going to create some long-term medical care needs that are continuing to stretch our healthcare system. The other thing to keep in mind, it's not just long COVID. It's also that COVID will sometimes do damage during the initial infection. It may damage your cardiovascular system. It may cause blood clotting that leads to insufficient circulation in certain parts of your body. It may cause lung damage that will manifest as ongoing problems breathing, ongoing difficulties. So there's a lot. It is a systemic illness. It is not just a respiratory illness. It affects your entire system. It causes immune problems. In some cases, people may be getting autoimmunity so that their own body is working against them going forward. So it is not something that you really want to get. And that's why I'm really uncomfortable with these people who are saying, oh, it's just a cold, you don't have to worry about it anymore. Because that's not taking into account the long-term damage it may do, the long COVID that may be occurring in a substantial portion of people who get it. And all of those are things that will affect people's ability to work, and it will affect their healthcare needs going forward. It can also exacerbate existing conditions. So if you're pre-diabetic, it may push you over the edge to diabetic. If you had cardiovascular problems before, it may make them worse. So there are a lot of reasons to avoid getting a COVID infection. And I wish people were doing more on the prevention side rather than acting like it's nothing to worry about.
Well, one of those prevention tools, of course, has been the advocacy of getting booster shots and getting that third shot. But there are many in the community who want to potentially get a fourth shot, but don't fall under the qualifications of age or being immune compromised. What do you say? Or what are your thoughts on a fourth shot, a second booster shot, if you will? And when do you think that may be something that healthcare professionals will be giving out more frequently? And at what point should people be looking to get that fourth shot?
I think fourth boosters should have been recommended already across the United States. As it is, they are still available to anybody who's got a condition that exposes them to more severe illness. Everybody above age 12, I think, is eligible for a booster at this point. And fundamentally, even obesity is one of those factors that can predispose you to more serious illness. So, my recommendation, push your doctor a bit, because you probably do have one of the many, many conditions. Look on the CDC website. There's 20, 30, 40 conditions, all of which predispose you to more severe illness with COVID. And that is a reason to get a booster shot. So, I would actually recommend people push on your providers a bit more to give you the booster, because it will improve your protection. It won't last forever. Like all the other shots, it does wane over time, but it will give you an additional month or two of protection against both infection and also increase your protection against severe illness. So there are major advantages basically to getting the booster, and I would recommend it for everybody who's eligible, and for anybody who's even marginally eligible, push on your provider a bit to get the booster.
On the subject of boosters and vaccines, of course, big news for parents with kids under the age of 5. They will soon, vaccinations will soon start flowing into the community for kids that age to get them. But I was just reading this morning that's saying that while there are, they expect an initial rush of parents getting them, for those of us who have been very eager, I know I have, to get my young child vaccinated, they actually don't expect the majority of parents to vaccinate their young children. To parents who are, weighing whether or not to get this, and really a lot of the reasoning, and even in my own friend group that I talk to, it's like, well, it's just a cold for kids. It's not a big deal. What do you say to parents who are on the fence on this one?
I would say people are completely underestimating the impact that COVID has on children. The problem you get is a lot of people in the media are comparing COVID in children with COVID in adults, and especially with COVID in older adults. And that is the wrong comparison. COVID in children should be compared with other illnesses in children. And the reality is, over the course of this epidemic in the United States, over 100,000 children have been hospitalized with COVID in the US, and 87% of those hospitalizations were for COVID, not with COVID. So those who want to say, oh, well, they just happened to have COVID when they got hospitalized. No, the majority of children who are hospitalized for COVID. So it causes severe enough illness that they have to be hospitalized. That number for Hawaii is 203 children have been hospitalized here in Hawaii with COVID. Okay. 800 children have died of COVID over the course of the epidemic in the United States. And 20% of those deaths have occurred during the so-called mild Omicron period. So children are still dying of COVID. So every child death is to be avoided. Children are not expected to die, especially in a country with a healthcare system as advanced as that of the United States. We should not have children dying. And people completely underplay. Again, it's just a cold mentality is completely wrong. This is a serious illness. 8,500 kids have had something called multi-inflammatory system for children. Basically, it's a multi-system infection where multiple organ systems basically get inflamed. They have to be hospitalized, and a significant number, several percent of them die basically of that, and it can be a prolonged hospitalization basically to treat it. So I think, we completely underestimate what COVID is capable of doing to children. What the more proper comparison is with other things that we vaccinate children for. When we're talking about things like rubella, chickenpox, those would kill maybe 30 to 40 children in a year under normal circumstances. COVID is killing more like 400 children a year. Okay, it's because COVID is so much more infectious and infects a lot more children. So those vaccines are really important because they will reduce transmission a bit. Again, not as much as we would like, but every little bit helps. But they will also protect the children against more severe illness, just as they do adults. And that's what's really important. Because even though the number of children is lower on a per capita base than it is for older adults, that doesn't mean that we can minimize those deaths among children or those hospitalizations. 100,000 kids in the hospital is nothing to sneeze at.
When you mentioned earlier, of course, the virus is evolving around, the protections that have been put in place, be it through treatments and through vaccination. Has the boosters and, say those vaccinations that are now available for kids, have those been updated to include, to battle against some of these new strains and these new variants? I mean, when we're seeing, as you mentioned, these different variants and different strains that are much different from the original sort of strain of COVID-19. Are these new booster shots that people are able to go in, have they sort of been, I guess, updated? When you update your phone and you have a new operating system that allows it to protect it from other viruses, is that the same with these types of boosters, that they have been updated to battle against some of these new strains?
Right now, no, but those boosters, so-called bivalent boosters, are in the works and are expected by the fall. And those will include probably, I think one of them that I know is being looked at is a Delta combined with an Omicron. So there's basically looking to try to get, a couple of the more prevalent variants basically into a booster and then administer those. Now, those probably will become available in the fall, probably, my guess, probably, October, November timeframe. And that will definitely be a shot that everybody should be getting boosted with at that point. Right now, those are not in the current vaccines, but that doesn't mean that getting boosted with the current vaccines doesn't help. It does. Yes, it's not as effective now as it was against Delta or the original Wuhan strain, but it is still very effective in boosting both your resistance against infection and your protection against severe illness. So boosting at this point, even with the older vaccines, is still very, very effective. It just only lasts a couple of months at this point. But that doesn't mean you shouldn't get it when we're in the middle of a surge.
I know that you track the cycles, not just here in Hawaii, but all over the world. So we see these surges and lags. You mentioned Portugal just a moment ago. I'm interested to know, how long do you think we're going to be in this cycle of going up and down and masking and then perhaps not masking? I mean, I know that you are at a place where you provide a lot of warning, but there are a lot of people who are watching who just say, I'm over it. And I know you're going to say the virus is not done with us, but there are a lot of people who are just done with this. So how long is it going to be this up and down pattern, do you think?
Honest truth, this could potentially go on for years. I mean, a lot of it depends on what we actually do to start arresting the transmission. Right now, in fact, the just let it rip attitude that a lot of people are taking right now, I'm done with the virus, is in fact contributing to more rapid evolution of the virus and therefore contributing to it getting around our existing protections even faster. I want to stress to you, Omicron, BA4 and BA5, in a matter of just 2 or 3 months, have worked around BA1 infections already. Your BA1 infection, when you got back at Christmas, it's not giving you much protection against BA4 and BA5 once those start to spread here. Okay, so we are seeing the virus evolve in real time, and that's a real issue. And part of the reason it's doing that is because people will not take precautions when the levels in the community are high. People should be masking. People should be getting boosted. We still have a major problem with people not being boosted in Hawaii. And those boosters can, in fact, save lives. They can also prevent people from going to the hospital. One of the things I would really love to see a study of, I wish DOH would undertake this. We are still seeing 100 people hospitalized every week. We are still seeing almost 10 people die every week. Let's study those people. Let's find out, were they boosted or were they not boosted? Did they get access to these new drugs that we have that we know are incredibly effective at reducing hospitalizations? And if they didn't, why didn't they? What's wrong in our system? What is preventing them from getting access to Paxlovid? That should have prevented many of these hospitalizations. Did they get Paxlovid and still get hospitalized? Or did they just never get it? And if they never got it, why didn't they get it? What is wrong with our system? And I think, there are a number of bureaucratic roadblocks in our system. There are a bunch of challenges in terms of now getting testing, in terms of getting access to treatment, in terms of getting a doctor's appointment so you can even get prescribed the drug. So I think there are a whole lot of different roadblocks that are there, and we need to clear those out. I think the fact that we are still seeing over 100 people hospitalized every week when we've got these drugs that should be very effective if people get them early enough raises some serious concerns for me. It tells me something in our system is not working very well. And we really need to find out what that is and then work to improve that.
Well, those are great questions, and we actually will have Dr. Levichar on this program later this week, so we will follow up and ask those questions. Unfortunately, our time is up. It always goes fast whenever we speak to you, Dr. Brown, but we really appreciate you taking the time to provide insights in where we're at with this, and just fair warnings again to help bring this again to the top of conversations amongst the fact that we are not out of the woods just yet. Dr. Tim Brown from the East West Center, thank you so much for joining us this morning.
Thank you, Ryan. Yanji.
Aloha.
Thank you. Aloha. Always sobering to talk to him, but very enlightening as well. We appreciate all your comments, and we did our best to summarize what you had to say and what you were asking to Dr. Brown directly. That last part, Ryan, when he said that we could be in this cycle for a number of years, just sort of, a punch to the gut for so many of us who are really, really ready for this to be over. But he's saying, look at the hospitalizations, look at the deaths, and look at how this virus is so quickly evolving around the treatments that we have. He mentioned that there's some even of those monoclonal antibody treatments that are not effective anymore because the virus has evolved past them. That said, there are a lot of treatment tools that he outlined. And if you missed some of that, please go back to the beginning when this is POW and watch it, or you can also catch the podcast that are available and that should be here in our community. He mentioned Paxlovid and then a bunch of other monoclonal antibody treatments that are available. So please do go back and look at that. And also, again, pushing for boosters and vaccines.
Yeah, we really heard that message from Dr. Brown in that while the booster may not include an update to combat the B4, B5 strains, that it still is important to get that message of wearing masks while indoors, just to do all that you can to help prevent any future spread, saying that this sort of rip it attitude that he mentioned by many in the community who are just done with it is actually elevating and will continue to spur on this virus and spreading and evolving within the community and beyond. We also heard him speak about the importance of course, as we mentioned, just those treatments of masking and of also just getting your boosters. But he also spoke a little bit about, the overall effect that it is having in the community and the impact that it is having on the workforce, saying that many continue to be out and that while the hospitalizations may not be impacted that much as what we saw in the peak, there are still a number of healthcare providers that are calling in sick that have been impacted by the virus. And right now that it is a serious concern with the level of spread that is happening in our community.
Yeah, and then we talked about long COVID. Nina Wu has an article in the paper about that study, or JABSOM study, I believe, that he referenced, or UHERO study. Sorry, I got to get my acronym right. The UHERO study that he mentioned, talking about that up to a third of people in Hawaii who identified as having COVID, were still experiencing long COVID symptoms, and that can be, a myriad of illnesses from brain fog to extreme fatigue, to the point where some people can't even work, and what that could do long term. So while the initial infection may be mild, you could be suffering with symptoms for months to come, if not longer. And so this is something that should be avoided at all costs. It's always great to hear from him, even if the information that he's sharing is not the most uplifting. It is very necessary and an important message. And as you mentioned, Ryan, we'll be having Dr. Libby Char on our program on Friday. We'll be bringing some of his questions to her. But first, on Wednesday, we'll be talking to Keith Hayashi.
That's right. This is the first time we'll be talking to the superintendent since he assumed the role of the superintendent. Of course, we've spoken to him in the past when he had that interim title attached to his name, but he is now the person in charge of our public school system, and we wanted to get an update from him on how the DOE is planning to enter this next school year, where mask wearing will be in this conversation of welcoming students back in, if that is something that the Department of Education will continue to press and require for students in classroom. We'll also get an update on some of the other things happening with what has happened through the legislature and funding for some of the schools and efforts being made on that front as well. So a lot to catch up with him regarding our schools. We hope that you will join us here for that conversation on Wednesday. Until then, thanks for tuning in. Stay safe, and we'll see you right back here on Wednesday. Aloha.
Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.